fungus between skin folds, pesky neck and shoulder pain, and potential cancer risk. What's up with all the side effects of wearing a bra? Keep watching to find out.
Finding the perfect bra is pretty much impossible.
When you think of bras and hot summer days, two words likely come to mind: boob sweat. This can lead to some unwanted conditions like yeast and fungal infections. A breast health specialist told the Cleveland Clinic, "You want to be mindful of how you position your breasts in a bra, particularly during warmer months. When you wear a larger cup size, skin rubbing can occur along the inframammary fold. The combination of sweat and friction creates the perfect environment for fungal infections to thrive." Blake says to ensure you position your breasts in the cups in a way that prevents any friction. To play it extra safe, spray some of your everyday deodorant between and beneath your breasts to fight sweat. Cornstarch is also a great option. In some cases, opting for a bra without an underwire can help ease irritation as well. Something else that's incredibly important is making sure you don't wear the same bra twice in a row without washing it. The buildup of bacteria, sweat, and dirt is a playground for fungal infections and can even cause body acne to develop. However, for those with bigger breasts, wearing a bra every day can actually help prevent body acne from developing because the bra acts as a barrier between skin folds, notes Dr. Constance M. Chen, board-certified plastic surgeon. If wearing a bra every day seems to be making your skin very angry, you're not alone. Dr. Heather Downs, board-certified dermatologist, told Healthline, "When tight clothing rubs the skin, it can cause excess sweating as well as irritation and inflammation of hair follicles. Not only that, bacteria and/or fungus on the surface of the skin can more easily penetrate into these hair follicles, causing infection." If you've been dealing with various skin issues around your breast area, you now know why. Tight bras can put you at a higher risk of developing painful skin issues like heat rash, hives, and dermatitis. Heat rash tends to develop when your skin's sweat ducts become plugged. Hives are a result of continuous pressure on the skin, like from a super tight bra. Dermatitis, which is an umbrella term used to refer to various types of skin inflammation, typically manifests as discolored, swollen, and dry skin. This can be incredibly uncomfortable and painful, and in some cases require medical treatment, especially if it spreads or doesn't improve. Wearing a bra every day might be the reason you're dealing with nagging back and shoulder pain. Robin Winchester, owner of lingerie chain Revelation and Fit, told Healthline, "The most common bra fit issue is a cup that's too small and a band that's too loose. This results in a bra that is unsupportive, uncomfortable, and leads to issues such as shoulder and back pain." Medical News Today warns that tightening the shoulder straps too much over a prolonged period of time can even cause permanent grooves to develop in your shoulder's soft tissues. Yikes. Dr. Heather Downs, board-certified dermatologist, said, "What I see in my practice are tight bra straps that rub on benign skin lesions such as seborrheic keratoses and moles. These lesions can then swell or bleed and can feel painful." Winchester adds that people often tighten their bra straps because the bra's band is too loose. This means you're not wearing the right fit and putting unneeded pressure on your shoulders. An ill-fitting bra can also lead to aches and pains in the shoulders, chest muscles, and neck. If your bra is causing any of these symptoms, it's time to go for a professional fitting. The right size will make a world of difference.
Can't wear a bra with it, Dad. It doesn't work.
Well, you're hanging out of it.
It's supposed to look like this. Everybody wears these. It's modern.
A bra that fits right, however, can usually solve all of these problems by easing any strain the back, neck, and shoulders experience on a daily basis. Also speaking to Elle, Carol Remy, communication manager for bra company Ompront, says that the right bra will provide you with all-around comfort, which can help eliminate back pain. She added that even when you simply walk throughout the day, your breasts move around 3 to 4 centimeters. When you're working out, these numbers go up. Remy said, "A breast can weigh more than a kilo, which is roughly 2.2 pounds, when you are a D cup or above. The pressure on the whole body is huge, especially for the back. Remember that breasts are made up of fat, glandular, and adipose tissue, and only the skin and ligaments support them. Wearing a decent bra takes the pressure off your breasts and the rest of your body and can help ease lingering aches and pains. According to Medical News Today, a well-fitting bra can even lead to better posture as well. The improvement in posture then helps to ease back pain. This is especially true for people who have larger breasts. Because part of a bra rests on the rib cage, it makes sense that it can affect your breathing, and if this is the case, it's time to investigate. There's a reason women no longer tolerate corsets after all. There's a fine line between a bra that fits snugly and a bra that's simply too tight. This can be especially tough to gauge with sports bras, which by their very nature are tighter to accommodate high-impact movement. But if you struggle to take a deep breath, it's a sure sign that you need to make a change. So don't go too hard if you do notice that you're struggling to catch your breath, especially if you're a runner. Your body heavily depends on sufficient breathing during exercise, and if you start to feel lightheaded or experience shortness of breath, it's time to stop what you're doing and invest in a bra that fits right. However, a breast health specialist told the Cleveland Clinic that women shouldn't underestimate the power of a good sports bra. It helps to minimize the movement of your breasts during high-impact exercises, and in doing so, you won't experience breast or even back pain. And a study in the Journal of Science in Medicine and Sport explains that sports bras were found to be the most effective when it came to minimizing breast movement during vigorous activity. The study recommends women wear fitted sports bras to ensure their breasts stay comfortable during exercise. Whether or not bras can cause sagging of the breasts is still a hot topic of debate among medical professionals.
I couldn't have a baby, but I had to fight the laws of gravity just the same, and you need the help of a good bra.
A few years ago, a sports medicine specialist revealed that he'd been conducting research on the effect bras have on women's breasts for 15 years. He said that bras are a, quote, false need, and that foregoing one could actually help the breasts lift, saying that women's nipples could lift by as much as 7 millimeters in a year's time if they stopped wearing a bra. The research, which included more than 300 women, showed that ditching this garment can encourage more muscle tissue to grow around the breast, which can perform the same function as a bra, according to HuffPost. The researcher did, however, add that not all women will benefit from throwing out their bras, and that the study has not been able to evaluate every single breast size. Medical News Today notes that the study was never peer-reviewed, so it's hard to say how accurate the findings are. The outlet adds that there isn't enough research to prove that bras cause or prevent sagging. However, those with larger breasts might actually prevent sagging by wearing a bra, simply because it provides much-needed support to the breast's connective tissue. According to the American Cancer Society, there's no scientific proof that bras can increase women's risk of developing breast cancer. They cite a 2014 study that aimed to find a correlation between wearing a bra and breast cancer. Out of the 1,513 postmenopausal women who participated in the study, no link between wearing a bra and developing breast cancer could be found. Medical News Today explains that it's likely obesity plays a bigger role than wearing a bra. Obese women tend to wear bras more frequently than their peers, and they're also more susceptible to cancer because they're obese. However, a 2016 study published in the Journal of Oncology Research and Treatment found a link between wearing a tight bra daily and an increased risk of breast cancer. The study also found that women who develop breast cancer frequently report that they sleep with a bra, whereas healthy individuals do not. The study's participants included both pre- and postmenopausal women. Researchers concluded that the tightness of the bra, as well as the number of hours it is worn daily, can have an impact on a person's breast cancer risk. According to WebMD, your bra might be the reason you're experiencing constant nagging headaches. When a bra doesn't fit right, it can cause unnecessary tension to build up in the muscles of your upper body, which can eventually creep up toward your head. Bra-fitting specialist Paula Svoboda told the Daily Mail, headaches can be triggered by bras which are either too tight or too loose, but more often they are caused by looser fits. Additionally, Svoboda says that you might experience continued neck strain and back pain. Tim Allardyce, Surrey Physio, said, as soon as the neck muscles become overworked, you are far more likely to get headaches. He adds that a decent, well-fitting bra will most definitely not cause headaches. Instead, it'll help protect the muscles surrounding your breasts and keep your breast tissue strong. You might not think about this when you're busy shopping for new bras, but the fabric the garment is made of is incredibly important. Sydney Ross Singer, director of the Institute for the Study of Culturogenic Disease, told Chalk and Juice, there are fabrics that are toxic because of their components, and there are fabrics that are made toxic by what is added to them. Synthetic fabrics, such as nylon and polyester, are polymers made in the laboratory and can break down into their toxic building blocks. He continues to explain that some bras can expose you to a carcinogen, a substance which forms when polymers, like the elastic used in some bras, start to break down. Singer also warns that other toxins like formaldehyde, fabric softeners, and detergents that are present in the fabric can mix with your sweat and then be absorbed into your skin. This is less than ideal, he said. I would recommend natural fibers such as cotton, bamboo, or silk. You can reduce the negative effects wearing a bra can potentially have and reap all the benefits if you buy the right size. In order to do that, you either need to go for regular professional fittings or know what to look for in a good fit so you know you're buying a bra that's right for your body. Paula Svoboda, bra fitting specialist, told the Daily Mail that the first thing you need to pay attention to when putting on a bra is its diaphragm. She said, the support comes from the diaphragm of a bra. If your shoulder straps fall down during the course of the day, it's a sign that support is not there. What you also want to avoid is breasts popping out of the cup. A proper fitted model will have your breasts sitting flush. Something else to look out for is the placement of the underwire. If it sits on your breast tissue instead of beneath your breasts, the fit is wrong. She also warns that a bra that constantly creeps up your back is a sign that you're wearing a size that's too big.
You've been blessed. Breasts are wonderful.